recording in progress. Hello, everyone, and welcome to another episode of School of Speech produced by SpeechTherapyPD, the podcast for all of us school-based SLPs. SLP says what? I'm your host, Carolyn Dolby, and I am so glad you are here because we are talking about something that's very close to my heart, music therapy, because I have a personal connection to this one. My daughter, True, she has a master's in vocal performance and is the head choir director at a huge high school in Texas. It's legit. So music has always been a really big part of our family. And I have had a front row seat to the power music has to connect people, bring out emotions, build community, and sometimes communicate what words just can't capture. But music therapy? That's a whole different profession, and one that I really don't know enough about. I think most of us know music therapy. We may have worked alongside a music therapist, seen music used with our students, and let's be honest, I think a lot of us use music in our own therapies, whether or not we can sing. I'm speaking about singing. But what really True gets it from her father. But what really makes something, what we're going to talk about today is what actually makes something music therapy. What's happening in the brain when we process music, rhythm, and speech, and what could happen when expertise of a music therapist and a speech language pathologist come together. That's what we're doing today. And I have the perfect guest. I'm super excited. My guest today is Anna Graves. Hi, Anna.
Hi.
Let me just tell you about Anna because she's amazing. Okay. She is a board certified music therapist and a graduate speech language pathology student. Yes, you heard that right, in Northern Colorado. Okay, listen to this. After she completed her undergrad at Truman State University, she earned her master's degree in music therapy from the University of Iowa. Then she relocated back to Colorado, because who wouldn't, because it's beautiful there, in 2022, and has primarily worked with children and adults with developmental disabilities. Through her work as a music therapist, Anna began recognizing that one of the most important needs of her clients was the ability to connect with other people through meaningful communication. And apparently, one graduate degree is just not enough for Anna. No, she says, no, I need more. Because in the fall of 2025, she began her SLP graduate program at the University of Northern Colorado. Not only that, y'all, she has also founded Melodic Connection Therapy in 2026 and is looking forward to bringing her knowledge of music therapy and speech language pathology together in a future career. Anna, again, welcome to School of Speech.
Thank you. I'm glad to be here.
Oh my goodness, I am so excited for this. My daughter already knows, and she's going to be listening because I'm like, True, this is us. All right, y'all, I do have some more housekeeping. Just reminders that every episode of School of Speech is offered for 0.1 HSCUs through your Speech Therapy PD account, because I always say learning should count. And if you are joining us live and your state requires live CEUs, please make sure that you complete all the course modules on your speech therapy account by the end of today. So if you need live, it needs to be done today. Also, if you are joining us live, please jump in the chat, say hello, and tell us where you're at. Hi, KK, nice to see you. All right. Oh, wait, you guys jump in the chat, tell us where you're at, and I'm going to do our disclosures. I almost forgot. All right. I am a salaried employee of Portland Public Schools in Portland, Oregon, and I receive compensation from Speech Therapy PD for hosting School of Speech. Non-financial, I am a member of ASHA, and I do volunteer for Feeding Matters. Anna, her financials, she is the owner of Melodic Connection Therapy, that sounds amazing, with no non-financial relationships to disclose. All right, Anna, let's get started. Hi, everyone. Look at where everyone's from. I love it. Hi, everyone. Thank you so much. I love that we have a live audience. Feel free to jump in the chat, and comments and questions throughout our talk today are welcome. I think I even forgot to say that earlier. So yes, please use the chat. That's what we'll be moderating, or I'll be moderating, and I'll ask Anna any of your questions that you might have. All right. I really want, my mind was blown when I met you because you have a master's already in music therapy, and now you're going to have a master's in speech language pathology. How did we get here? How I need your origin story.
Yeah. Well, obviously, I like school. That seems to be the like resounding thing.
Right.
But like you said, I started in my undergrad at a small school in northern Missouri, and there I was playing clarinet. That was my whole thing. I graduated with a clarinet performance degree, which is not a super marketable degree.
Okay.
But throughout that time, I had kind of the opportunity to work really hard and get really good at playing clarinet. So the first couple years was really focused on being really like perfect and detail oriented in my practice. I would spend like probably 6 hours a day playing clarinet on a normal day. Kind of like crazy behavior. Um, so really exhausting, high intensity. And after my sophomore year at Truman, I had the opportunity to volunteer in Tanzania. So it was a music education and conservation program, kind of linked together. So we would go out in the mornings and do tree plantings, because the tree that makes clarinets is only grown in this like specific region. It's called the African blackwood tree, and it only grows like right around the equator where Tanzania is. So we would go out in the mornings, do our tree plantings and prunings, and then we would walk to different schools and do music classes throughout the mornings and afternoons for local students. And that was like a month of my life, but probably one of the biggest like transformation moments for me when I realized like music isn't about being perfect and like getting every run as clean as I can and who can play their scales the fastest. It was more about like what you can do with music. Music is more of the means to an end than the end itself, is kind of the conclusion I came up with after that trip for myself. So that kind of made me rethink what I wanted to do after undergrad, and I landed on music therapy because it seemed like the perfect, like, you use music to get to something that's not music. And I've always like enjoyed working with people. So that seemed like a good fit. I went to the University of Iowa, like you said, did my coursework there, and then moved to Colorado for my internship. Kind of like SLPs, we have to do a 6-month internship that's all in one spot. So you really specialize right out of the gate. So I did that internship, and then I did home health out in Colorado for about 3.5 or 4 years, working a lot in the Denver suburbs, and some clients up in northern Colorado, but I was living in northern Colorado the whole time. So it's a lot of commuting. I would often spend more time in my car than I would seeing clients, which isn't really the balance you want in a life. But the way music therapy reimbursement works, it's really tricky to do something other than that unless you go out and do your own thing. But I wanted to have something that was more stable and kind of like fit more with what I wanted. Because throughout this music therapy work, I kind of like lost a little bit of that love for music that I had because I'm doing music all day for work. I'm sure your daughter can relate when you're like in a classroom doing music.
The last
loud,
thing she wants to do is go to karaoke. Sorry for interrupting.
Yeah, exactly. I was like kind of forced into karaoke a few weeks ago, and it was one of the most like unpleasant experiences of my life. It's great people, but like not a good time. I've been around enough like mediocre music for the day. So I wanted to kind of get out of music therapy being my full-time thing. And as I was doing some reflecting on what felt valuable for myself in my current work, it was just that like I get to let people connect and communicate with the people that are important in their lives more effectively, and to be a part of a community, which I think is kind of what we all strive for in life. So as I was assessing like, where do I go from here? SLP seemed like kind of the like next move for me, where I can have like a fun job and still work with the kids that I enjoy working with, lower acuity than hopefully I was working with. Because in music therapy, like burnout really is, I know that's a big discussion in a lot of helping professions, but with music therapy, burnout and kind of like losing your coping skill of music is a huge like balance to strike. And the way music therapy is set up, you only see the people with like the highest acuity of needs. So most clients that I started with at my job, I had the same caseload when I ended my job. There's not like discharge, goals met.
Mhm.
That doesn't really happen. There's always room for improvement. You might see plateaus and then you like take things in a different direction for a while. But you see the same kids and there's not that like, oh yes, we did it kind of feeling. You get those like day to day, but you never get someone that's like, great, like go out, live your life. Like I did my job here. So that can just be really heavy. And so I decided to go back to school. And here I am. I've been in school, like you said, since the fall of 2025. And then I start my last semester of coursework next week. And then I'm off to internships.
Congrats. I love it. I mean, welcome to the fold. We need more SLP. So welcome. We are welcoming you. And even better, you to be an SLP who happens to love music and be a music therapist. I just see this is just going to be magical. But I know that a lot of us here, we are SLPs and we've seen music therapy. We've worked alongside, like I said earlier, but what exactly, you know what, I know this is a basic question, y'all, but I am truly interested in like exactly what is music therapy? What is it? What is it not? That might just be as important too, because just like speech therapy, everyone could benefit from speech therapy. Everyone could benefit from music therapy. Mm-hmm. So what exactly, do you mind if we start there?
Yeah, it's a good spot to start.
Good.
So music therapy, my like quick definition of it is using music to work on non-musical goals. That's kind of how I like phrase it to families when I'm first starting out with someone. But there's a few elements that make it like music therapy rather than like a therapist who uses music, like an SLP might do. So music therapy is evidence-based and it's focused on music. So we, like SLPs, think about like the internal factors. What does the research say? What does the client need to make our interventions? So you have evidence-based. We use music interventions and it's individualized goals. Music therapy also has a little bit more focus on the therapeutic relationship that forms between the therapist and the client. Different therapists like think about this differently, obviously, but that's more of a like factor than I've experienced thus far in my like baby SLP career. And then the other main like factor is that it's a credentialed professional. So any music therapist has to complete a music therapy program. We take a board exam, we have to pass it, we have to get continuing education credits. So in a lot of ways, it's structured very similar to that of an SLP.
So I am an SLP who loves music. I was first a kindergarten teacher and I was the singing not well. I don't sing well. I don't know how, like I said, my daughter gets stall from her dad. But I guess maybe give us a little bit more music 101, 101, on like, is it different than an SLP just simply adding music to their therapy? You know, like, because a lot of us use music, so we're probably like, oh, so are we music therapists now?
Well, that's like where that board certification kind of comes in. And music therapists, we receive a lot of education about music itself. So in order to get a music therapy degree, you basically complete a whole music degree. So like you saw with your daughter, you have to take lessons every semester. You get really good at a primary instrument. You play in ensembles. You take music history. You take music literature. You take music theory. Like all of these like classes that give you the basics. Yeah. They're kind of intense sometimes.
Yeah. Oh yeah.
So you kind of start as a musician first and then kind of form a therapy lens is the way that I've kind of experienced the whole like transition to being a music therapist and life as a music therapist. And within a therapy session, music therapists usually use live music. And we use a combination of voice, guitar, piano, percussion, and any other instrument that like we're like good at and can use therapeutically. So we are really intentional about how we alter musical elements like the rhythm and the tempo and the harmony and the structure and dynamics to help support a specific output. That's where kind of like the, like some people call it magic of music works, is like we get all of these elements like really put in together in the right mixture and the right kind of organization to help support an outcome.
I love that. I love when you say using music to support non-musical. What did you say? Say that again, because it was really cool.
I usually say using music to support non-musical goals.
Non-musical goals.
Yeah.
Okay, I love it. So when we were talking before, when we met before, you blew my mind, and when you started going into the neurology and the brain, and as SLPs, and I know everyone else is here is ready to nerd out. Can you just go into like what is happening in our brains,
Yeah.
or are your clients' brains?
Yeah.
When,
So
when we add that layer, yeah.
for sure. Yeah, so one thing that I like to go back to, it's called the neuroplasticity model of music therapy. So it's basically how music is affecting your brain that supports outcomes in music therapy. So there's three main elements that are occurring. So the first one is dopamine, which we know is involved in reward and motivation and engagement and learning. So when you listen to music, you'll get like a dopamine dump, which supports engagement, supports learning. And so in a way, like you kind of use that as like, oh, you did this outcome, great. Like we're gonna do music, you get all the dopamine, you're learning this faster. And then the second thing that we think about is the Hebbian principle. So this is the idea that neurons that fire together wire together. So if all of your neurons are going at the exact same time, they're all firing together, they're all going to form a lot tighter, a lot quicker connections. So this is like at the synapse level when you think about the neuron, where you have the axon and the dendrite and they meet and everything happens all at once. So with music, you can see like fMRIs that they're crazy. They like blew my mind when I saw them, where it's like someone just listening to like, it might have been like a very simple song, like a twinkle twinkle, and their neurons will light up like to the pulse of the music. And so you have all of that synchrony happening that will help form those connections faster to again support quicker learning, quicker engagement, quicker reward. And then the last thing that music therapists kind of think about when we're trying to get things to work really well for a client is the signal. So the signal that you're processing in your brain. So you can compare music to noise, where noise, you can think of like white noise or brown noise, and it's all like staticky or even like random environmental sounds. There's not organization to that. It's all pretty random. So in music, when we have beats arranged in a pattern of high stress and low stress, and we have predictable melodies that rise and fall in like predictable 4-meter phrases, it all makes sense and it all is like very nicely segmented to help support someone's engagement. So those are like the three things in music therapy that really work toward growth. So you have the dopamine dumps, you have that Hebbian principle, fire together, wire together, and then last you have the like clarity of the musical signal versus noise. And then music therapists use all of this while they're like playing an instrument and singing a song and like juggling other things to support our outcomes. So those are like the main three neuro things within music therapy.
I love that. Dopamine dumps so they get them engaged. Fire and wire are neurons, so our synapses are firing and they're wiring and they're connecting faster. And then the signals are mathematical in nature.
Yeah,
Because
and
music
clear
is
and precise.
clear and precise, and yeah, and I do like sometimes the predictability
Yes.
of music for that anticipation. I liked one of your research articles that was looking at the rhythm processing in speech and music. I love that because that, as an SLP, I was all like, okay, rhythm processing, speech and music. Okay, that's working for me. I love that. So what do we know? So music with those three things, right? So what really matters for our children with speech and language disorders with music therapy?
Yeah, so With speech and language, a lot of these things are kind of like overlapping, where you have the dopamine that's going to support your engagement, and that's going to support like the salient language models,
Anna, I don't know if it's,
learning.
sorry, Anna, I'm going to stop you a minute.
And
I don't know.
then within speech,
I'm so sorry. It went out completely. So as you started answering, I didn't hear anything. I don't, anybody else, if somebody in the chat would let me know if it's my end, or did anybody else have a, connection?
okay.
Okay. It cut out.
Let me
Okay.
double check my.
So sorry.
Okay.
Thanks,
No
guys.
worries.
So, yeah, we'll have to go. So sorry, I missed everything. So starting out again, if you don't mind, making that connection of what does music, why does that matter for our students with speech and language disorders?
Yeah, so speech and language, when you're thinking about all of those things we just talked about with music, um, you can increase your engagement, right, with all of those principles we talked about, which then increase your salience of your language models. There's also a lot of research about speech coordination with music. So that's the article you were talking about. It's the PRISM
Yeah.
model. So it's a processing rhythm in speech and music is what this stands for. And it's the basis of a lot of other cool research that's coming out now. So they kind of break this down into three, again, like major topics that support rhythm or support speech through music and how we process both of them similarly. So we have that precise auditory processing. So we have a really clear signal, which is exactly what we were just talking about with music. There's sensor motor coupling. So that's how your perception is wired right into the production. So all of those things are happening nearly simultaneously, which is like tracks right onto that Hebbian principle we just talked about, where all of these things are firing together, they're wiring together, everything's working really smoothly. And then lastly, you have the synchronization and entrainment of your neurons. So this is exactly, again, like even that everything is happening at the same time. And in both speech and music, there's a hierarchical arrangement of this. So in music, you have those big beats at the beginnings of measures or at the beginnings of phrases, and then you have smaller beats in the middle. But then in speech, you have things like, here's a sentence. Okay, breaking that more, there's clauses. There's two clauses in your sentence, and then there's words within your clauses, and there's sounds within your words, and everything is arranged in this like pretty precise auditory structure. So with this, there's a lot of similarities in the way that people process rhythm and speech. So incorporating something like a steady beat for someone who has motor planning difficulties could be effective. Incorporating like music to support that engagement, just to get that little dopamine dump to keep you going for like, those tricky to engage kiddos, could be a really effective strategy as well.
So again, we're having just a little bit of trouble, but I want to make sure that we have got it, because I heard the big beats, like we do like a full sentence, and then I like the little beats because you're speaking our language with that music is hitting all the same I guess points that we do with language, like, right?
Yeah, there's like similar organization to both.
That's it, the organization. I was asking Jordan if there's anything we can do with your technology, and I think if it keeps going, we might need to have you jump off and then jump back in.
Okay.
You seem, yeah.
Yeah, let me know if we need to do that.
I think you do, because you just froze again. Sorry.
Okay. All right. Be right back.
Okay, thanks. And for our listening audience, I'm so sorry for a little bit of a hiccup with that. If we end up going longer, because I do have so many questions for her, if we end up going longer and you are only able to stay for the 60 minutes, I know life happens. We've got kids, we've got animals, we've got life. If you do need to go, I totally understand. And yes, you will still get full credit. But I do hope everybody stays because I'm telling you, this is such an amazing topic and conversation that I am so excited. I'm just as excited to learn about it as I'm sure you are. Um, and I do know that my daughter has her master's in vocal performance, and it's tough. And what I loved the most during her time was she was transcribing, and so we really got to connect on doing transcribing, and we would send each other notes and stuff. And so now we have our own little private language, kind of like all of us together as an SLP when we're doing our transcriptions. So that's kind of that's fun, a little fun fact. I think if it's all right, I might ask her to kind of go over what we were just talking about again, maybe a little faster, or I mean, a little together, because I kind of missed a few things that she was saying regarding the process. Okay, thank you. Yes, thanks for responding, y'all. And I sure do appreciate your patience. I haven't had, actually, I had technical difficulties one other time and this is my 5th season. So hey, 2 out of 5 seasons, not bad. Okay, she should be coming on anytime. I would sing, but you would not like that. So actually, you're welcome. Yay! Anna is back. Thank you, Anna, so much. Oh, you know what? KK, thank you. I meant to get you those references. I have them. So I will get those references and I'll put them in the chat. Right about now. Yeah, no problem. Thanks for asking. Hi, Anna.
Hi, sorry about that.
No worries. Oh, yep, I'm gonna send the references right now. And then I am so sorry to have you go back. It's just we are so interested in everything you have to say. Um, so I'm not quite sure where we left off or where we start up again, but let me just send this in the chat to everybody. There we go. Okay. There's all the references, and I meant to have that earlier. Thank you for reminding me. Anytime, any of our returning or listeners, always remind me because I would love to do that. Okay. All right. We were just talking about why music matters for our children with speech and language disorders. We were talking about the connections that it makes and how similar the rhythm of music is with the rhythm of speech. Is there anything I missed out of that? Oh no, here, I'm going to text you.
Okay. Is that better?
So I've crossed everything I can possibly cross.
Great. That was everything sounds clear on my end. When I got back in that last time, it was like kind of weird getting the audio, and then it just kicked me out. So
Oh,
third time's
okay.
the charm.
Amen. All right. All right. We're going to start up with how music helps us. Oh, good. Yay. You sound good to everybody. Thank you. Thank you, Lindsay. Thank you. All right. Why it matters. Let's go why it matters for us as speech language pathologists. Yeah.
Yeah, so as SLPs, music can really help enhance those outcomes with those like Hebbian principle,
Mhm.
dopamine, all those like synchronicity and reward things that we talked about. Music is also just something that people are engaging in a lot of times in their life. So there's a lot of familiarity with that. You might get some more initial buy in. Um, in just like strictly a speech therapy setting, music therapy could be a great like dopamine dump to help those kids who are like trickier to engage,
Mhm.
those like younger or older ones who just have their own ideas of what they want to do. Um, there's also, if you're more like musically, I guess, know more about like music theory and stuff, there's a lot of different things you can do with like prepositional words and things like that. Um,
Say more
and
words. Say more words about that.
like the befores, the afters. I a lot of times with kids, I'll use a piano, and it's kind of tricky on piano because it's like low and high, so you can do like above, below, faster, slower. A lot of like descriptive words with music. Um, One of my favorite things, I'm doing a little more telehealth music therapy now, which telehealth is just a tricky time. Zoom is a tricky time, as we've learned
Yeah,
today.
yeah.
So I do a lot of like song chats with my like older clients to work on some of that like emotional expression that's really in the realm of music therapy, and then thinking about like how much detail can we talk about with this song and that expository language of like what's going on here. Um, yeah.
I went you did you say song chat?
Yeah, that's usually what I call it. Yeah.
Tell me again, I am so interested. So explain that.
Yeah, so usually what I'll do is I'll start with just like a list of musical elements, like the ones I talked about earlier. So I'll have a list of like um, timbre, rhythm, tempo, melody, harmony, structure, repetition. I'll usually have a separate one for like singer because usually we're listening to songs that have a singer in them. And then just thinking about how many adjectives can we come up to describe this like rhythm, which then you're learning more about music in there too, but then you're learning more about like, oh yeah, this song is pretty steady, but there's also parts that are kind of unpredictable. So that's one that I also used to work on, a lot of like attention to detail. And then in music therapy, that's also a really nice like mindfulness exercise. We're like, okay, we're gonna listen to like this part of the song, and we're just gonna listen for what is this guitar doing? Like, key in really heavily on that. So a lot of things with like moderating attention in that one too.
Oh, I love that. Right. Telling them what they need to listen for, getting them
Mm-hmm.
engaged, and then tuning in, honing in so that they are paying attention to the detail for, especially for our kids that maybe are a little less focused.
Yeah.
Wow.
Yeah, and even for those kids that are less focused, kind of sandwiching the work in a song, or I'm sure everyone's doing like playing or like a game or something like that, but even sandwiching like, okay, we're gonna do like however many like productions or trials of your goal, and then sandwiching in that like dopamine dump of something musical,
Hmm.
like could be a good
Nice.
way
So
to help
so the
engagement.
whole thing is just constant therapy. Wow. Um, I want to know, are there certain student populations where this connection is especially interesting between music and speech and language?
Yeah, from like my experience and then some of the literature I've read, there's like the autistic community is like,
Hmm.
for in my experience, kind of hit or miss. Like most of the clients that I've had, music is like a little superpower
Hmm.
where they can engage so easily in music. And this also goes along a little bit with like gestalt language processing of like learning things in chunks, being kind of sing-songy, but
Yes.
really picking up on that like structure of music has been really impactful for a lot of my autistic clients. um, I there's also kind of like a group of people who just love listening to music. I see it especially in like the like developmental disability population. Like most of the clients that I'll see, I'll like ask them their favorite song, and they have like three go-tos. Like, yes, I'll listen to this on repeat every day. So I'm like, great, this is a good starting point. We can start here, and then we can kind of expand what we're doing. We can learn how to play these songs and do like fine motor. We can think about, how does this make you feel? Like, how could we make this song sillier? How could we make this song angrier? And things like that. There's also that, just like the neurodiverse population. I feel like when I'm going into sessions with someone that I don't know very well, maybe a first or a second session, I'll really rely on that like Hebbian principle of like, I don't care what we're doing it, but we're doing to a beat. Like, we'll be together, we'll have a steady beat for this hour. And usually we can get something like pretty good accomplished in that time. We can have more sustained attention, and going in with those like kind of principles in mind of like, what's going to work in like this brain, and how can I like play with that with this person.
We do have a question that came in, if it's all right if I ask.
Yeah.
So she writes, I've always thought that children with apraxia are dysrhythmic. I know that childhood apraxia of speech and its treatment cannot be simplified, but I am wondering if you've heard of any music therapy that can benefit that population specifically.
Yeah, I don't know exactly if the research between like apraxia and music therapy, or like apraxia and music perception, but dysrhythmia is kind of a separate thing altogether, compared to apraxia. And there's like, so there's some research that I've seen between like dysrhythmia and dyslexia kind of go hand in hand, which seems kind of like an obscure connection, but interesting nonetheless. But from my understanding, dysrhythmia is kind of separate from apraxia, so it would just have to be an individualized thing of, does this person seem to be rhythmic? If I'm playing music, are they moving to the beat or in some semblance of a beat? So I would encourage you to think about those separately and think about just like the individual. Does this individual have a rhythmic like side to them? Because there are some people who are like fully dysrhythmic, who cannot keep a beat, and that's just the way it is. But then you might want to rely more on those other principles, like that dopamine and providing that clear signal.
Thank you.
Yeah.
So I know that I really want to get into co-treatment, because us as SLPs, we're not trying to become music therapists, but we're asking, what does music therapy know that I don't know? What do I know that they don't know, right? So we both are coming, we know what we know, you know what you know. So I guess my question is more about what can happen when we put together two philosophies, two disciplines, if you will. Right? Because, I mean, so many questions. I guess, okay. Maybe my question is going to be, what could a really good SLP/music therapy co-treat session look like?
Yeah. So I think ahead of the session, both having like familiarity with the client is really helpful. And like a little bit of like debrief of like, here are the goals, here's where we're struggling, here are our goals, here's where we might need some support, to kind of do a quick little like planning. And in the real world, we don't have like meetings for this, obviously. No, it's usually like in the moment, okay, we're rhyming today. It's like, great, rhyming song it is. And I think one little like special thing about music therapists is like, you write songs all day, every day. Like, give us a topic, we'll write you a song about it. So I could share like an example if that would be helpful.
Yes.
Okay, yeah, so this one example I'm thinking of, it was a client that I'd been working with for a couple years. Speech therapist, also had a lot of familiarity with her. We'd met in passing, and the goals that I had for her were mostly around attention and engagement, really those like basic things, those building blocks to other skills. And then her speech goals at that time were phonological awareness. So they were really just working on identifying rhyming words, just a yes or no. And with her limited attention in other therapies, her data for rhyming was like guessing at best.
Oh.
Really just limited on her attention and how much she's actually listening to the prompt. So the SLP had asked if we could do a little coach read on this. I said, sure, whatever. So I just like wrote a little quick song about rhyming words, and we sat down and we did our little rhyming word song. And I knew that this client had a lot better attention to music. She was really listening to the words that were coming out of my mouth when I was singing, not so much when I was speaking. It was one of those sessions where like any direction I give, I'm singing. And she always had better accuracy in those singing versus those spoken tasks. So I had a hunch that this is going to be good. She probably knows how to rhyme words. Not having done much language stuff with her phonological awareness, she's always an underestimated gal. So I sat down with the SLP and I said, great, this is kind of what I'm thinking. I'll do this thing. It'll be like our dopamine dump. We'll get those steady beats in like a chorus. And then I'll end with like, do these two words rhyme? And end it on a big like tension chord. The SLP will give the trial because that's her domain. I'm not trying to control your trials. So she gave her trials and then client would answer. So in our first session we did this, she went from like I said, guessing accuracy to like 90% accuracy. Like, girl knew rhymes. She just wasn't listening to the prompts. So things like that, where it's like, you're just underestimating, your brain's not quite in it right now. But kind of to see like, what can you do was really the like thing for this gal. And through that, like, I supported that intention. I had that predictable structure. We had like the engaging, like, all right, I'm playing guitar, we're being fast, we're being loud, you're like shaking your eggs, we freeze, you tell me if they rhyme, great, we do it again. So things like that where there's just like a little limitation that maybe you just need a little extra support in. And music therapists can usually come up with some idea.
I'm just curious too, like, how would it work with like speech production?
I think
you get co-treat with that?
Yeah, I've done a lot of like kind of like earlier intervention kind of stuff with speech production. Even just like vocalizations is something that I focused a lot on. So when you think about that, like predictability of a beat, where you know it's going to be 1, 2, 3, 4, 1, 2, 3, 4. You're always going to have that pattern. One thing that I've done is we have a song, so like Matilda the Gorilla, where you sing a little chorus and then it's all just like kind of nonsensey syllables, and then we're using that melody that's descending. So there's a cute little chorus about a gorilla, and then there's a whole part that's like ooh 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 ah ah ah, and then at the end it goes ooh 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 ah 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 ah, and then the last one is theirs to fill in. So with that like predictability, and they have that descending where it like falls right where you need it, like ah 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 ah. What are you gonna do? Like, are you gonna say it? And then you say it, and then we have a little jam, we have a little party. Great. I've also done that within a co-treat for like specific sound productions, where then we'll like have a song that's maybe simple or maybe a little bit more complex and more like kind of what we always want to go with the preference, so what that client is interested in. And then we'll add a section where like, okay, maybe this time we sing the whole chorus on do or foo or loo to get these productions, and then I'll give you that one specific trial that's kind of set up in a similar way to where like you know exactly where it's gonna be, we're gonna lead up to it, you're gonna want to do it, and we're gonna do it, and it'll be great. So those are kind of the strategies for like speech production.
Yeah, fun. And is there anything that we need to watch out for that wouldn't work in a co-treat situation?
Yeah, so I think like students who are overwhelmed by a lot of people in the room, that's something where like we don't need like 3 adults in the room for one kiddo, if you know that's going to be difficult. I think the like attention is kind of a fine line. If there's attention that's like really supported with music, then that would be a great opportunity for a co-treat. But if it's like an attention thing where when there's more things around, it's just like bopping around to everything, then maybe that's one where you have a music therapist come in and do like an evaluation, see if this might be helpful, and then proceed from there. I think the other thing to think about in a co-treat and also when you're just using music in general is being aware of like, what is this client's preferences? Are there like sensory concerns we need to be aware of? If I bring a drum in, is this kid gonna like bang the drum really loud? It's gonna disrupt everyone. Obviously, maybe then like we need to be more choosy about like what the music therapist is bringing in, which is their job, and also like, do we need these extra people and extra supports? And it could also be a good opportunity for like a consult with a music therapist to figure out like, what could I do as an SLP to better support this student?
Oh, I like that. Yeah, a consult. Because yeah, so I've seen when a lot of like the music therapists that I have seen are doing they're in a self-contained classroom. The student is in a self-contained classroom, so there are other students around and they're engaging all the students, but I know their focus is at their goal with a certain student. And that makes it very doable in the schools because school is all about being able to access their curriculum in a group setting. But do you agree with that, or do you feel that it's more important for like an individual speech session versus group? Because that I would like to see how that could kind of fit in with our school setting.
Yeah, well, I think it would like obviously depend on the student, the school, the situation, the classroom, like how old they are. But yeah, what you want for a student is to be able to access the curriculum as independently and as like typically as they can, right? You don't want to like be pulling them out all the time. So I think that's also where an SLP might have a consult with a music therapist and loop in the classroom teacher or the para or whoever else is involved to figure out these strategies that we can all be using. So maybe it's this, if I'm thinking about that client that was really engaged with rhythm, maybe an accommodation that the para makes and the SLP supports is, okay, if we're giving individual instruction to this person, we're going to do it to a beat, and we're just going to chant it to a beat to help them really access these words more effectively. I like my experience in schools is so limited, so like if there are like more specific examples or like questions you have, like
Yeah, well, I'm just trying to think of like how do we keep from having co-treat turn into two professionals just how do we make it co-treat versus parallel play, I guess is my question. Like more, right? Rather than each discipline is doing their own thing. They're just doing it at the same time versus maybe incorporating it together. But I suppose you started that with like maybe agreeing on a goal beforehand because you're working on the same goal.
Yeah. And I think there's also in group settings, I think a lot of room for co-treat to become more impactful than an an individual therapist leading a session for a group, because you can have an extra hand helping out with stuff, modeling language, supporting access. So in that like self-contained classroom example that you gave, maybe a music therapist is leading like a lot of the music stuff, but I've seen some where it's like people are giving ideas for songwritings, and maybe we're all just sharing our ideas in like, what animals do we do? How are they moving? What are they doing? How are we gonna like put this all together into a story in our song? And the SLP then could be more guiding the discourse and organizing those ideas in a way that makes sense and supports everyone's language output and their narrative skills. So that's like one kind of idea where it's like music therapist has their lane, SLP has their lane. But we're working together and using each other's strengths and professions to kind of support all these students.
I love it because every time you say dopamine dump, I love that because you're right. It's a great way. I mean, music is just that Well, my sister would say juggling is the international language. You guys, she's silly, but she does. She's so funny. She learned to juggle. But I think we would all agree that music is the international language. I think it doesn't matter where you go, what language you're speaking. Everyone can enjoy music because it's global. And then what I'm hearing you say, and what I love as a speech pathologist, is that you're bringing in access and a way to engage a student, right? And then just another way to elicit language or elicit sounds or whatever goal it could, for any goal I could see this working with, just incorporating music for a student that maybe isn't like so hypersensitive that, but even then, I bet there's something rhythmic that would work, just maybe softer.
Yeah, or even like for kids who are more like sensory reactive, using things that are more like tactile. So I use like an egg shaker that they can feel how the beads shake in their hand. Or even I have kind of these big drums that I'll dampen and then they can like play it and feel like all of that like vibrotactile input. So there's other ways that you can access music that's not just hearing it at a loud volume.
I like that you're bringing in the other senses of feeling the music. Like you can feel like, you're out there and you hear the big bass drum. It's like you literally feel it in your body. Right? Yeah. And then I like that, the egg shaker. And now we've got more participation because they are, I love it. Okay. Oh, what a great question. Do you ever do partner dancing for peer interaction? Oh my gosh, Teresa, I hope you're okay. I shout out your name because this just blew me open some wonderful ideas. Not only partner dancing, yes, but also like partner playing, partner what is it called when two people sing together? Like why?
Like a duo or like
Thank
duet.
you. Yes, a duet. I don't know why I was like, it was out of my head.
Yeah, I love doing groups where I like pair people together to do things. So I'll do sometimes like dancing. I'm not a dancer, so I like try to steer away from like choreographing things because that's not really where my comfort zone is.
Know thyself.
Exactly. You don't need me to dance. But I do like doing like pure, a lot of times I frame it as movement because sometimes clients are like not into dancing either. So I like shadow movement games where I have a song playing, one person is the leader, they move to the song, the other person is their shadow, they have to follow because they're shadow. So things like that I think are really enjoyable. And I love like partnered instrument play because when a music therapist shows up with a bag of things, the first thing people want to do is like, what's in there? What can I play with? So one of my favorites is doing like paddle drums where one person holds the drum and the other person has the mallet. So you have to be able to engage in this joint thing where I'm holding this to support you. So we'll do that to like well-known songs. Sometimes I'll do like Eye of the Tiger because that's kind of a tricky like well-known rhythm that people can get. And then we have certain spots where you switch. Okay, the other person has to do this. So anything really, if I'm in a group setting to incorporate people interacting with each other and not interacting with me, I think is a win because I'm not going to be there all the time. This kind of goes back to, like you were saying about like, it's not all pull out, like be with your peers, go do your thing.
Right, because a lot of, we do want to encourage peer interaction with a lot of our highly impacted students. Ones that are, their disabilities are, it impacts them so much. And a way to get some interaction, more so. I mean, I'm just thinking, there's children that their voice is through their AAC, but then they're speaking the same language when they're both doing the music. Like it almost like levels the playing field in some ways, as long as they are physically capable. I mean, I'm sure that there's I mean, again, I'm not a music therapist. I love music, but I could imagine that you have adapted um, instruments for students with different physical disabilities.
Yeah, like adapting instruments to be able to access, because, like you said, it's all about being able to engage and being able
Mhm.
to kind of be like feel normalized in a way. Like you said, music is something that's really universal. Everyone can engage in music, everyone can take in music. So allowing people to do that in kind of like a normalized manner. And one term I kind of like for this is musicking. So this is something that like musicology people have been talking about for a while, but I had to read a book about it in grad school the first time. And it was about like musicking can be any way of engaging in music. It could be the person like playing a violin in a concert hall. It can be the person listening to the radio in their car. It can be the person selling tickets to the concert. Any way of like engaging in music and like in that community of being musical is like a valuable piece of being a musical person. So like you said, that like adapting and being able to engage with everyone.
Well, it comes down to the very first thing you said. I've been writing notes. I know I'm a nerd. At the very beginning, it's connection and community.
Mm-hmm.
It bridges connections and builds community. Look at me being a wordsmith. I
There you
love the
go.
word musicking. I had an episode on languaging, so I love making a yeah, right. I love that. Another question in regards to another form of um, neurodiversity, which is verbal diversity or stuttering. Um, do you have you had experience with music therapy and like music therapy with speech with people who stutter?
Yeah. Um, this the experience that I've had with this wasn't like a co-treat. It was an adult client that I had for separate things who also stuttered. But when we're singing, we don't see the stutter because it's all just aligned with the beat. Was the experience that I had, and I don't know a whole lot about stuttering. Fluency is coming up next week,
Oh, okay.
but
Well, there's a lot of very famous singers
Mhm.
who stutter, who have verbal diversity. Nina Reeves coined, she's the stuttering guru. She's actually been on my podcast twice. I can't get enough of her talking about verbal diversity, which is the another term for the stuttering. And then when you see how many famous singers say that they also are a stutterer, a person they are a stutterer, that it makes me wonder about that. And I mean, tell me if I'm wrong, y'all, but I thought that music uses a different part of the brain. Am I right on that? Am I, and that,
Yeah, music kind of gets the whole brain involved because you have like
okay.
a rhythmic part and you have a prosody part and you have an emotion part. So that's where like in stroke rehab too, music therapy is really effective because we can kind of
Mhm.
rewire things to not be all in that like left temporal lobe. We can like reroute where language is going. That's where like MIT is really effective. So I imagine it would work in
Yes.
kind of a similar um, manner of like those types of interventions, but I'm not an expert on that one. That's a really interesting question, though.
Yeah. So, well, next semester when you're doing your stuttering course, you can
Yeah, I'll follow up.
follow up on that. So you like the melodic intonation therapy, isn't that, is that how,
Hmm.
yeah. Those of you that are live, have any of you worked with I know we're all school-based, so have you worked with the older, I always say the geriatrics or the adult, I'd rather say the adult population. I have worked in a post-acute, and it's just fascinating to watch and to see the connection that some limited verbal adults really engage. And, you know, that might have a flat affect, but then all of a sudden you are seeing just you know, just joy. um yeah, so I've seen the power of music with across ages.
Hmm.
Being a kindergarten teacher before became a speech therapist, I did sing every single almost every single like directive. It just made it just I don't know, it just I didn't know at that time the power of that, or the connection, or the research behind it. But I like how you said that music therapy is research aligned. And just hearing you talk, you can hear just how much you know. This isn't just some, oh, you know what? I like music. I'm going to be a therapist. No, I mean, it is a certified, very well, um, um, what am I trying to say? Training. Um,
Yeah.
really specialized. It's not, so we're not here as SLPs going, oh, I want to become I want to do music therapy now. We can't call ourselves a music therapist. And I'd say music therapists, except for you, cannot call themselves an SLP, but you will be soon, which I think is absolutely delightful. And then, oh, thanks, Maddie. Yeah. They use songs in therapy for memory recall. Yes. Topic maintenance, stamina. I mean, I'm just thinking of all these things that really do lend itself to utilizing music in our therapies. Right? I love that. So, like I was saying that, that I think we should all use music. Because I do thank you for the benefits of using music. If kind of want you, if you think about, you have such a wonderful perspective. You've got one foot really firmly planted in music therapy. That's right. And now you're putting the next foot into speech pathology. What has becoming an SLP changed the way has it changed the way you think about music therapy now that you're becoming a speech pathologist?
Ooh, that's a really good question.
I know I put you on the spot on that one.
I know.
Sorry.
I think my perspective is always changing on that. And I think it's like one thing is the difference in the education between like the music therapy education and the like speech language pathology master's program. I felt like they're so hard having to like.
Oh shoot. Anna, you've cutting out again, y'all. Oh, I'm so sorry. Let me give her a minute. You cut out for a second. Sorry, you froze.
This is so frustrating.
So sorry.
Okay.
I know. I could just imagine though, like as you start learning the parts of speech pathology, that your music therapist would come out and go, "Oh, I have a song that could really help with this disorder or this delay." I was just wondering if like there's anything that you're like, "Oh yeah."
Yeah, I think there's been a couple of things that I've been kind of focused on because we have like an on-campus clinic. That's where we're doing all of our practicum right now. So there's a couple clients and I'm like, oh, music would be great here. So I'm like kind of trying to like dip my toes in like what is my role as this kind of like, I'm both. Like I can do both things. So I had like a late talker last semester and we would just do phrases and I set out our carrier phrases and this is like what we're focusing on, and then I made melodies for all of them, and then every time I modeled it I did it with that melody, and then she started picking up on the melodies and she got it, like she's good, bye, like discharged. So things like that where it's like music can be a really salient way to get that language exposure like we were talking about earlier. And then I think too with the in like the executive functioning realm,
Ooh.
there's a lot of like overlap between like what I can work on in music therapy and what like or maybe like informal goals or maybe formal goals depending on the student in speech therapy. So kind of thinking about like what can I do for attention here? Like can I like make a nice little like musical mnemonic about like putting this thing in your planner? Maybe like that could be a thing that's worthwhile. So I think right now I'm just like, ooh, the world is like my oyster. I can kind of figure out where I want to go and what I want to do. But there's definitely moments where I'm like, ooh, music could be like really great here for this client. Yeah.
This is just exciting. Yeah, you are just embarking on such a wonderful career. I love being an SLP, and I wish that I was also a music therapist. You're going to have the best of both worlds. Is there anything that I haven't asked that we were talking about before? I would hate.
Um, I don't think so.
Okay, I just want to make sure that we.
Stuff.
I know we really did. So, I mean, basically, music therapy rocks. It is a wonderful way to get a dopamine dump, to get your neurons fired so they're wired together, making those connections, ways of getting things all over your brain working. And oh, I've forgotten all that. Oh, and then the signals and the synchronicity.
Yeah.
I love it. I know that we are towards the end. We need to start closing it down. Anna, I want to thank you so much. I love this conversation because it just reminds me of collaboration. And I think collaboration is key in the schools. I love it. I love understanding that we each bring totally unique things to the table. And yet we can work together, and it just strengthens both of our jobs when we work it together. I love it. Thank you so much for being here. Okay, listeners, thank you for your patience today. Sorry about some of the technical difficulties. I want to thank all the listeners for all the work that you're doing in the schools. Anna, thank you for all the work you're going to be doing in the schools and with our students. If this episode resonated with you, please share with a colleague who does need to hear it. And don't forget, guys, that you can earn 0.1 ASHA CEUs by completing all those course modules inside your Speech Therapy PD account. And you need to do that today if you want live CEUs. Anna, again, thank you so much. All right, bye, everyone. Stay curious, stay collaborative, and I will see everybody next time on School of Speech. Bye, guys.